Plantar fasciitis is a condition that occurs when the tendon that inserts from the heel bone to the front part of the foot gets overextended and overpulled. At times it feels like to me half of America has this problem. And if you look at the statistics, at one time or another, probably half of America does have this problem. And when I look at this, there is issues that are associated with it. The society we live in, the type of floors that we walk on, the type of shoes that we wear, the fact that as a society in whole, we've put on more weight than our previous generations. These are all contributing factors. But when you look at why ultimately this occurs, it's secondary to the foot structure that a particular patient may have. Those who have flat feet are very common to have this condition. Those who have high arches are very prominent as far as this condition goes. And basically what it is, it's an overpulling of this tendon in one sense or another, and it creates inflammation where it inserts into the heel. And the problem with this condition is that once it starts, it's magnified on a day-by-day basis. It's magnified by the fact that we walk on concrete surfaces, by the fact that we're active, we're all trying to exercise, and we're all trying to do activities. Typically we see it after periods of activity, after sitting, but what happens is as the condition worsens, it tends to become a continuous type of an event that bothers at all times. The problems with this, of course, are pain. People tend to give up their exercise or their activities, and also they start to walk differently. So they tend to lift the heel quickly. As they do, it puts a lot more pressure on their forefoot, and they may start to develop discomfort in their forefoot. It puts pressure on their Achilles tendon because they have to lift the heel quicker, and by doing that, they may get pain in their hamstring or in their Achilles tendon area, or they may even develop knee pain, hip pain, back pain because they're no longer using their heel bone properly, which is meant to be the primary shock absorber of your body. Now, the good news for this condition is it's generally treatable from a conservative standpoint. We use a variety of modalities in a conservative setting that really and truly, for approximately 90% of these cases, we can get them better. And I always tell patients it's like building a pyramid. We will build them a base. Some people I get to be Miracle Man, where they're better. 1 or 2 visits and they're good. Others, we have to add in other modalities in order to get them better. And we do really offer everything when it comes to the conservative care of this problem. Medications, paddings, braces, and we do have shockwave therapy, which can be a successful option prior to a surgical intervention. Unfortunately, 10% of these people will require a surgical intervention where we need to go in and release the tendon to take the pressure off the heel bone. And even with that, we're able to do it microscopically, which does lead to a quicker recovery period. I would say patients that have heel pain, I know it's painful to think about getting it treated, but think about more than your heel and think about other issues that can occur, and we are really dedicated to getting this better.